Welcome, and as you know, I'm George Vukmer. I'm your eye surgeon here. First of all, thank you for trusting me and trusting my team. Hopefully we'll lead you through a process of improved vision, something that should not be terribly frightening or difficult. The most difficult things are the unknown, and I hope to address some of those unknowns today, talking to you about your cataract surgery. I hope to answer some questions, demonstrate what I'm about to do, but I'll be available. And before the operation and after, I'm willing, and my staff is certainly willing, to answer questions as they come up, particulars to you. I cannot tell you that each cataract surgery ends up with a perfect result, but we promise our perfect effort for you. And any particulars in your surgery should come out in the examination before we schedule the surgery. Any unusual characteristics of your eye, any special challenges should be discussed. This is a generic talk of cataract surgery, how things should go. Allow me to demonstrate your eye, at least a model. A normal eye does not have a scum on it. A cataract is not a scum. A cataract is a cloudy lens deep within the eye. The surface of the eye is called the cornea, and it should be crystal clear. Behind the cornea is the iris, the colored part of the eye. Behind the iris is the lens of the camera. When you're born, the lens should be clear as water. At my age, there may be some clouding of the lens, yes, some cataract. Cataract or lens clouding gets worse as you get older, and there are many conditions that cause it. If yours is cloudy enough to affect what you do, be that reading, driving, causing light sensitivity, giving you difficulty in doing your daily activities, is when we're about to repair a cataract. So a cataract is a cloudy protein lens within your eye. Cataract surgery is done in the hospital operating room, where there are sterile conditions and many precautions taken to get the best visibility of what I'm about to do, the best nap for you with an anesthesiologist to make your time there easy, and very sterile technique. We do not do cataract surgery in the office because we don't have the facility for that sterile operation. A cataract is a cloudy lens in your eye, and cataract surgery is a lens exchange. During your time in cataract surgery, you will be napping. You do not have to help me. I have an anesthesiologist who understands your medical history, watch over you, and help keep you safe and comfortable throughout the operation. Most people nap between 14 and 15 minutes around the time of their cataract surgery. The procedure time is usually less than that. The procedure is a nap for you while your eye is held open and bathed with sterile water and antibiotics. I look at your eye, which is held open. You're not aware of this. You're sleeping. I look at your eye through an operating microscope through the clear cornea, and the pupil is dilated to reveal the lens. A cataract surgical incision is done with a diamond. The diamond goes through the clear cornea to make an incision like a microscopic paper cut that is shelving through the clear cornea. There are no blood vessels in the cornea, so there should be no bleeding. The incision normally heals without a stitch, and normally within about a week. I enter the eye with a tiny instrument. The instrument is a small water vacuum cleaner, and it dissolves in place the lens protein of your eye. Water, and if the protein lens is solid or hard, ultrasound energy helps to dissolve the cataract and wash it essentially from your eye. The lens is not completely removed. Everything is done within your eye through a very tiny incision. The cataract is washed out, and its envelope, if you will, the tiny thin sac wall that contains the lens of your eye, is left in place. At this point, an implant, and I'll demonstrate at least one model of an implant, an artificial lens is used to replace your lens. This is a model of a lens implant. A lens implant is a tiny artificial lens, and this tiny lens, at least this is a model of one, is specifically designed for your eye. Each cataract surgery, each patient has their own style or power of this implant. And the artificial lens implant is folded, if you will, like a taco. It is folded and passed through a straw-like shooter, through the tiny wound, through the water of the eye, through the dilated pupil, into the old lens envelope where it unfolds like a butterfly. Hopefully dead center. These implants last forever. They largely block ultraviolet light, but they let crystal clear visible light in for better vision, and our goal, better vision and thinner glasses prescription for you. Each implant is tailor-made for each individual by its power, and the incision even is tailor-made for your eye to minimize nearsightedness, minimize farsightedness, and minimize your astigmatism. Perfect without glasses is not always attainable. That's our goal. Certainly each individual has to be preoperatively measured by me with the equipment you see behind me. You'll recognize this room as one of the rooms that I evaluate your eye. And the measurements that we take for the power and nature of the implant are specific to you. So cataract surgery is a simple lens exchange. Your cloudy lens protein, cataract washed out, artificial lens called an implant replaces it. These implants last forever. The course of the operation incurs risk. Every procedure, every passage we go through here incurs risk, and that risk is individual to you. If there is any particulars you need to know, anything about your eye, whether that be poor pupil dilation, diabetes, glaucoma, or even high pressure in the eye, I'll address these individual concerns with you. If you have specific questions, please ask. I or my staff are happy to answer. But the risks of the operation are important for you to understand when you sign an informed consent. Risk, all tallied, from very minor concerns to vision-threatening complications, tally less than 1 in 100. The serious 1 in 1,000 risks include bleeding in or around your eye. This bleeding can be severe and can even interrupt the operation. Infection. The eye is a sterile chamber. The operation is done sterilely, and we treat your eye beforehand and after for up to a week with antibiotics to prevent infection. Infections are extremely rare, but they do occur, and that's part of the reason there's very close post-operative monitoring of your eye as you heal. High pressure in the eye or glaucoma can harm the eye and actually be painful. We take precautions to keep these pressures reasonable after the operation, keep your eye comfortable, and make it safe. A very common worry here is picking your appropriate implant for you. The Implant Power is a professional estimate. I've done over 10,000 cataract surgeries with implants. We have a great deal of experience. We do here both optical and ultrasound measurements of your eye to estimate the power of the implant, but it is a professional estimate. It is possible to get a result that requires glasses. Slight nearsightedness, farsightedness, or astigmatism, that is, warp of the light as it enters your eye, are correctable with glasses and hopefully will be kept to a minimum. Picking the power of an implant that's not correct for your eye can result in the need for glasses, and while we do a perfect effort, we certainly cannot promise perfect without glasses. The unknown in what I address every day makes me check and recheck these measurements for you before each and every operation. Further complications to discuss are rare. Serious ones such as a dislocated implant in an improper position, a retinal detachment, serious bleeding in the back of the eye under the retina. These are vision-threatening complications that are fortunately very rare, certainly do keep me on my toes. In the course of all my surgeries to date, I have not lost an eye to any one of these serious complications, but we're aware of them, we're attentive, and we're watchful. My purpose in telling you about potential complications is by no means worry. You'll do better if you trust my team, trust the anesthesiologist, and have faith in me. I will do my best for you. But to stand before you and say that I'm perfect is a long exaggeration. Certainly, you're going to get my best work. Complications occur, and in the course of signing an informed consent, you must be informed of the potential for these complications, as well as my desire to do a good job. Individual concerns, preoperative worries, best be addressed with me personally, perhaps my staff, because I think the more you know, the less unknown before you enter the cataract surgery, the happier, the easier time it will be, and hopefully a kinder and gentler surgery with an easy outcome for you. My goal is to make your life better, not stressed, and I encourage you to put that worry on me and allow me to answer any questions that you have. Thank you in advance for your faith in me and my team. I have full confidence in them. And the anesthesia team here in Meadville is truly wonderful for a small town. I have no concerns there. They will watch over your health and keep you comfortable and stable throughout your procedure. Good luck to you. You'll be in my prayers and thoughts. I'll do my very best for you. And thanks again.